Hey there, it's Dr. Sarah here. Today on the She Found Motherhood podcast, I have the absolute pleasure of chatting with Aliya Dhalla. Aliya is a pelvic health physiotherapist with over 10 years of experience. She exclusively focuses on women's health, including prenatal and postpartum pelvic health. She also works on preparing people for labor and delivery and focusing on common issues that happen during pregnancy, including leaks, pelvic pain, painful sex, and diastasis. Today, our conversation focuses around just understanding your pelvic floor and the intricacies involved in what happens during pregnancy. We talk a little bit about what virtual pelvic physiotherapy might look like, and so much more. Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good morning, Aliya. Welcome to the She Found Motherhood podcast.
Thank you so much for having me, Sarah.
I'm so excited to have you here today and to meet you.
Likewise, it's nice to make these relationships like on Instagram and then have more in-depth conversations after. So I'm really happy that you invited me to be here, and I'm so happy to chat with you.
Oh, me too. Oh, I'm so thrilled. And honestly, this is probably our sixth podcast around pelvic health, but I don't think we can talk about it enough, to be honest. The education, I feel like we have decades to catch up on because we really, I think, did a disservice to a lot of pregnant and newly parenting people by not educating about the importance of understanding your pelvic floor and your core in pregnancy.
I think you're so right, because you know what? People need to hear things a number of times before it maybe sinks in, or maybe they understand the concept. People need to hear things from different voices and in different ways. So it's great that you've had so many conversations like this already, and I'm happy to contribute another one, because I really think that a lot of people become pregnant and they don't know what to expect, like these changes with their bodies, and then simply educating people on like why things may happen and what's happening in your body. That's crazy empowering for people.
Totally.
Feel like they have some control or understanding of the experience as opposed to something that's happening to them.
Exactly.
So I think education is like a form of healthcare. It really is. So this is a great way to do that.
That's awesome. So I couldn't agree more. And I think one of the hardest things about pregnancy is that you don't have a lot of control. So if you have an understanding and if you engage in some pelvic floor physiotherapy or just education and understanding, that you can actually take back some of that control of what's happening to your body.
Absolutely. I think that's exactly it, right? When we don't have control, then we feel like helpless. It can obviously affect our mood. It can affect our whole experience. And by learning about why things are happening or why we may feel X, Y, and Z, or maybe why we shouldn't do something, if we understand it a little bit more, we actually know that we may have an option as opposed to, don't exercise this way or don't do this thing, or you have this back pain, you should stop that. If we understand why these things are happening and be curious, and then it may not be the end of the day. We can just try something different.
Totally. Love it. Okay. So we were chatting about just talking through a basic understanding of your pelvic floor, your core, your lower back, your hips, how they're all connected, and what changes you might see and experience during pregnancy.
Yeah, I love this topic because I feel like it's really just foundational. And for
Totally.
some people, this just helps them understand. And that's all they need to feel like, okay, I got this. I can do this for the next number of months. And for others, it might be like, oh, I can go and talk to someone to learn more about myself or have an assessment or whatever it may be. So let's get into it. I love talking about that.
Yes. Okay. So I'm going to turn it over to you because you are the musculoskeletal expert in the Zoom room.
Okay, perfect. No pressure, right?
No, not at all.
So I guess we can start by talking about what the pelvic floor is and like where is it in our body. So our pelvic floor is literally like the bottom or the floor of our pelvis, right? Our pelvis is a bony structure that, connects our legs to our spine, and our pelvic floor really is like a hammock or, a layer of tissue that sits on the bottom of that pelvis. It makes up the floor of the pelvis. And it's made up of 3 layers of muscles, connective tissue, nerves, fascia, and so on. And what that structure, like what our pelvic floor does, is it helps us to do a lot of these things that typically happen in our bodies without our conscious awareness. It helps us to keep things in like pee and poo and farts. It helps us to let things out at the right time. It helps us to support the organs that sit in our pelvis. So it helps us to support our bladder, our uterus, if we have one, in our rectum. It helps us to give us some of that inner stability so that when we move and when we exercise or we're just like people going about our day, we have some support, some stability on the very inside. And it also makes up a part of our core, our very inner core unit. It works with our diaphragm, which is our breathing muscle. It works with our deepest abdominal layer and some tiny muscles in our back. And those all work together to form our core. It also helps to circulate lymph and fluid around our body like a sump pump. And it also plays a huge role in our sexual function and pleasure. So it's really an important part of our bodies. It's one that we can't actually see. To feel and to assess those muscles, we have to be inside our body. So if we want to feel it on ourselves, or if we go to a pelvic floor physiotherapist for an assessment, that will be an internal exam. So a finger or 2 fingers inside the vaginal canal or the rectum. And that's how we can feel the muscles to know what they're doing. So that would be something that would be warranted if you're going in for an assessment because maybe you have something that doesn't feel right with one of those main jobs that our pelvic floor does. Maybe you're leaking, maybe you have pelvic pain, or so on and so forth. So that is really like where it is in our body. It's there in our pelvis. It connects, if we want to get a little bit more technical, it connects at the front to our pubic bone, and it goes to the back, connects to our tailbone, and then from side to side, it connects to either sit bone, so our ischial tuberosities. Really just makes up the bottom of the pelvis. I wish that you guys could see me right now because I could show you a model.
I know. Well, link to your Instagram, and I'm sure you've got stuff on there.
Yeah, that's
Yeah.
great. That's perfect.
Yeah.
So it's like a really important part of our body that we don't pay attention to until something stops working the way that we want it, the way that we want it to work. And so if you haven't ever given any thought to your pelvic floor, that's okay because those muscles are actually supposed to work automatically. They're supposed to work in anticipation of movement or changes in pressure. So it's a good thing if things are going good and you don't even know where this part of your body is. But during pregnancy, there's a lot of changes that happen, obviously, in our body. There's huge changes to the shape of our body and the position of where and how we hold ourselves in space. When we have a growing belly, our center of gravity is changing dramatically. It's getting pulled forward, right? So that can have a ripple effect on how we may hold our body in space, like what our posture may look like. We may end up tilting our pelvis a little bit forward, more into an anterior pelvic tilt in order to the weight of the belly will just pull us that way. Some of us adopt that posture. Some of us may tuck our bum under and flatten through that spine, and that might be more of a posterior pelvic tilt. And there's all these things that we can do with our bodies, often unintentionally, to accommodate the changes, which are happening quite rapidly if we think about it, and steadily over time. That fable about the frog that's in the pot of boiling water, he doesn't notice that the water is getting hotter because it's happening slowly. Sometimes that's what happens during pregnancy. We don't notice the changes because they're very subtle, but our pelvic floor definitely has a lot more work to do when we are pregnant. Remember, one of the jobs of those muscles is to help to support what's inside the pelvis. Now, when we're pregnant, we have the uterus obviously growing in size, and inside there we have the placenta, which is a whole new organ that our body creates. And then we have the fetus, and we have the amniotic fluid, not to mention the fact that our blood volume is increasing, our breast tissue is growing. There are so many things that are growing in our body and changing. And so our pelvic floor just simply has more weight to support. So that in itself is something that makes the rest of the jobs of the pelvic floor, keeping the pee in, can sometimes be more challenging. It's like working overtime for the same amount of money. It can be, so that's why sometimes in pregnancy, that's when we first notice that, oh, I'm peeing a little bit when I sneeze, but that's never happened to me before. So these things are super common, and it could be explained by something like that, right? Like our pelvic floor, honestly, it's just poor thing. It's just doing a lot more work. And then if we're changing our posture, which we all have to change our posture to accommodate our growing and changing body, our pelvic floor may be in a position where it's like not functioning optimally, or maybe it's not in the best alignment, if we're going to call it that. And remember, the pelvic floor just makes up one part of our inner core unit, right? So our deepest abdominal layer is called our transversus abdominis. And that is a muscle that pretty much runs from like the bottom of our ribs to the top of our pelvis and wraps all around our midsection like a corset. So when we activate or contract this muscle, we can imagine that it like cinches us like a corset. Or if you're pregnant and you're able to activate this muscle, you can feel like you're hugging your baby closer to your body. So now that muscle co-contracts or works with our pelvic floor. But during pregnancy, we know that our belly is getting bigger and bigger. So that those muscle fibers are stretching as well. It's important to think about not just what's happening in the pelvic floor, but all the things above and below it as well, because it all impacts how things go. And sometimes there's a lot of chatter out there about how don't do this exercise when you're pregnant, like never do planks. And I feel like all of that fear mongering can be detrimental. Do you agree?
Exactly. I 100% agree. It just makes you feel like such a fragile flower and that you have no control over your body.
Exactly.
And that your body is like weak. Oh, don't do that.
Yeah, you might hurt yourself. Yes, exactly.
Yeah.
And I think it's really unfortunate because, especially now in the age of social media, you can honestly find information for anything you want. And it's really hard to know what's accurate, what's evidence-based.
Totally.
It's really hard. It's really hard to sift through it all, even as a professional. I see these things, and if it's shiny and glittery and the font is great, my brain tells me it's true as well. So it's so tricky because I think that the messaging that our bodies are fragile, that we're going to hurt ourselves, we're going to cause a big problem by doing X, Y, and Z exercise is not good, because we should be strengthening appropriately our body, including our core during pregnancy, in order to support us, in order to support this changing body, our changing posture, and all of the things that are going on. So the pelvic floor and the whole inner core just really goes for quite a ride during pregnancy.
Oh my gosh, totally. And I think something that people don't often understand is I get a lot of people coming in pregnancy and they're having hip pain, the pubic symphysis pain, and low back pain. And I'm always like, go see a pelvic physio. And they're like, but it's not my pelvic floor. And I'm like, they will help you. And there's this, so there's this, and understandably, because we're not really taught a lot of musculoskeletal anatomy outside of a formalized sort of healthcare education.
Sure.
So I'm like, no, trust me, go to see a pelvic physio and they'll help you back, because they're all so interconnected.
For sure. Because if you really think about it, like the pelvic floor is just a set of muscles that happens to be on the inside of our body, right?
Yeah.
So it's really just orthopedics inside your body. That's what it is. It's muscles and it's bones and it's the action of muscles. And those muscles don't work in isolation. So if we're having low back pain or we're having hip pain, these things are really connected. I often say we can't just look at the pelvic floor and ignore everything else out there. That's not the right way to do things. And me personally, I like to take a whole person approach. So not only do I look at your pelvic floor and like the muscles and the structures around it, but we're talking about like your life and the stressors that are going on and how supported you feel and other things, because these are very important when we're talking about managing pain and managing changes in our lives and stages that might be challenging. So to look just at the pelvic floor, I think would be a disservice. So that's so great that you're telling people to see someone for their back pain, because keeping our body strong, like keeping our pelvic floor, but keeping like our hips and our back and our core muscles and just generally our body strong. I'm a huge fan of movement for obviously exercise and all the strength benefits, but also for the mental health benefits. But pregnancy is like, it's a trip for your body, right?
Yeah.
Like I said, we're constantly changing for those 9 or 10 months. If you're not maintaining your mobility and your flexibility and your strength, like you're going to have aches and pains. Like it's going to be harder work for your whole body to manage them. Not to mention the fact that then you have to like push this baby out.
Yes.
And then you have to recover. Yeah. Then you have to recover your body, and you're doing physical work. Being the parent of a small child, a small baby, is physical work. So why wouldn't we train for it? Why wouldn't we at least keep our strength up?
Oh, yeah. I think one of my biggest, I don't like using the words regrets, but in my pregnancy, so I was first pregnant in 2013, so pushing 10 years now. And people weren't really talking about this. And I was like a physician who looked after pregnant and postpartum people. And pelvic floor was for, physio was for people who like, old ladies who had incontinence. And so I have had issues with running. Like I've had high hamstring pain, and I've got like TFL. Is that it? I don't know. See, more muscles than I do. And I'm just like, and it has to do with my weak glutes because you just let them go. You're just like, oh, can't do that exercise during pregnancy. Wither away, body.
That's exactly it. And you're so right. In 2013, I bet you nobody was talking about it, especially like you live in Victoria. So
Yeah.
that's like a smaller center compared
Yep.
to, other bigger cities. But I
Yep.
live in Toronto. It's a very big, progressive city. And my son was born in 2015. So a little bit after your first child. And exactly the same. Like I had a couple of friends who had done their training in pelvic health physio and they weren't practicing, but they had done their training, maybe one day wanting to practice. But I had been a physio at that point for 6 or 7 years. So I wasn't a new grad. I knew all about the body. That's what I do. But I really felt like, why am I so unprepared for this?
Yeah, totally.
Why is this a
Totally.
surprise? And so that's what got me into it. Is like after my son was born, I had some pelvic floor dysfunction of my own, and then I wanted to obviously rectify that problem. But then I was like, if I'm so lost and confused, and
Yeah.
I'm a specialist in the human body, other women have to feel like this too. And so I just really like headfirst dove into learning as much as I could. And now this is like really all I do. And I love working with people who are pregnant and postpartum because it's all just, I wish someone had told me that.
I
Nobody
know.
told me that,
I know. I couldn't agree more.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and re-watch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
I want to ask you, you don't have to give away all your secrets, but what are some of so what I've come to learn with lots of conversations with some amazing pelvic physiotherapists on our podcast is that you should do pelvic physio during pregnancy. And so what are your sort of recommendations for pregnant people in terms of if they're getting pelvic physiotherapy, what kind of things that you will be doing with them? What conversations, what assessments, what recommendations do you typically make during a sort of first trimester, second trimester, third trimester? I know it's a very big question, but just so people can understand like what it might look like.
Totally. This is a great question because I think you're right. People don't even know that it really exists and then what to expect. So I think it depends on the type of pregnant person you are. If you're someone that is not experiencing much pain or any like pelvic floor dysfunction like leaks or any problem, and you're just wanting to go in for a check, I do think that's a great idea. I would say go in for a check, at least in your second trimester at some point. And that way you can have someone assess the muscles to see like almost what your baseline is. Like, how are your muscles? Are they super tight? Because pelvic floor muscles that are always in a really tight state, they can cause issues down the road. A tight muscle doesn't always mean that it's a really strong muscle. It can cause low back pain. It can be a root cause of a lot of things. Or do you have muscles that are like just really loosey-goosey and like having a hard time contracting? And then you can address these things before maybe it becomes a problem. Your baseline, you get some individualized exercises to address strengthening or stretching or a combo during pregnancy. Now, if that's enough for you, I think that's a great place. If you want to learn more about how to prepare your body for labor and for birth, if you're
Mhm.
hoping or planning for a vaginal delivery, or if you're the type of person that likes to be prepared for postpartum, like what are the things that I
Mhm.
should have or do or think right now, then you could definitely see someone a number of times during your pregnancy to
Mhm.
go over what are some ideal stretches or positions to put your body into in the last
Mhm.
4 weeks of pregnancy, how to stretch or mobilize your perineum. So, to help to minimize severe tears of the
Mhm.
perineum during a vaginal childbirth. And you can even have someone do that for you, like a pelvic floor physio could do that for you in clinic as well and teach you how to do it at home. What are the positions that will help your baby engage in your pelvis
Mhm.
and move down and drop down, and why? And how do you get into those comfortably? How can your partner support you during pregnancy? What are some hands-on techniques that he or she could do to help you manage pain better? What are some other things that you could do to get your mind ready as well as your body ready? So it really depends on the type of person. Some people I've worked with are like, I don't really want to know all that stuff.
Yeah.
That's not going to help me. That's making me
Yeah.
like more
Yeah.
and more thing to do.
Yeah.
And that's fine. Other people are like, I need to know these things and I need to do as much as I can to protect my pelvic floor and to be in charge of the situation as much as I can. It depends. I think that there's some pelvic floor physios who don't maybe go into such detail about how to prep for birth and these types of things, but there's a lot that I think do. It just depends on experience and training and comfort level and maybe interest. But I would say for sure, get a check-in somewhere in that second trimester. If you want to see someone regularly throughout your pregnancy for education and learning, as well as some hands-on techniques that can help you feel better if you're having aches and pains or you're having issues, then that's great too. Not to mention the fact that any pelvic floor physio, I mean, I'm saying any, but hopefully any will give you like exercises to make sure that
Yeah.
you're maintaining your muscle strength and the key muscle groups that we need to maintain our posture and to help to prevent low back pain and et cetera, like your glutes, like you had mentioned. So it really is a long answer. That's not one answer. It depends
No,
on the kind of person you are, I guess.
totally. But it's really helpful. And I think just for people to understand, why would I go? I'm not really experiencing anything right now, and what benefit is for me. And I think that there's a huge potential. And I think you learn more about your body the more you explore. But my first pelvic physio session, I was like, she was like, my muscles were like so contracted. And then
Yeah.
she taught me how to relax my pelvic floor. And I was like, oh,
Mhm.
like,
Yeah. That's so funny that you had that experience, but it's so true.
yeah.
We walk around like squeezing
Hmm.
everything, but we don't even know it. And then that's not helpful
Totally.
too if we're thinking about the pregnant person, because if it's a pregnant person that
Hmm.
you don't know how to relax your pelvic floor and you're hoping to have a vaginal birth, we do want to be able to connect to our pelvic floor and be able to relax it and to know what that feels like and to figure
Hmm.
out how to do that in our body before we're like 10 centimeters dilated. We
Oh my
should know how
gosh.
to do that before. So that is one of the main things that I go over for sure with anyone that I work with is let's figure out let's figure out how you can connect with your body. Like how do you contract the muscles down there? How do you relax them down there? How do you connect that all with our breathing? And then if we're talking more specifically about preparing for birth, like what are things that we can do to make that easier in that type of an environment or scenario?
Oh, I know. It's so true. And I really um appreciated how you were talking about connecting with our bodies, because I have just come to realize in the last few years I've done a lot of like exploration and understanding and deeper looking into, like, for lack of a better word, the mind body connection. And I,
Yeah.
as a family doctor, I also support people through like postpartum depression, anxiety, generalized anxiety, depression. And we're so focused on like up here and pointing to my head, we forget that we have a body, and we're like, how do we connect with it? What does anxiety feel like in my body? And for you, your anxiety might feel like a super tight pelvic floor that you're just not connecting with. And then a birth experience for some people can be very anxiety inducing. So if you're just contracting and contracting, like it's not going to give you probably the best outcome that you could have if you had a better understanding of like how what your body feels like. We're just so disconnected these days.
Yeah, that's so true. And it's so important that you say that because that's exactly it. Like giving birth and even the whole process of being pregnant, for
Mhm.
some of us, it's a joy. For some of us, it's just wonderful and positive. And for others, it's not. It's a source of anxiety. It is maybe scary. I know during COVID, I've worked with many people who have just
Yeah.
felt like just really alone in this whole situation. It's different than what they imagined it to be for
Yeah.
so many reasons. To know that what's going on in our mind truly does affect the
Yes.
presentation of our body and can manifest different ways in our body, and learning that about ourselves, learning what we do when we're scared. I have like a small group workshop series that I run for pregnant people, and I usually hold it 3 times a year. And it's called Before Birth. And it's just like all about this type of stuff. It's education, it's learning about your own body and how to prepare. And we spend a lot of time talking about this fear, tension, kind of pain cycle that exists, like beyond our conscious awareness almost, that when we're
Yeah.
scared of something, we anticipate pain, then our body does things. So what does our body do? What does your body do? It might be different than mine. But oftentimes our body might tighten up out of protection, and then we're tightening up, and then the next contraction hits or whatever happens, and like we experience pain, and then it like reinforces that
Yeah.
fear, and we're stuck on this cycle. So we chat a lot about different strategies and ways to practice breaking that cycle, because the time to figure it out is not when you're 10 centimeters down
Yes.
and pushing. So we do need to talk a lot about preparing our mind and our body and how they work together, because they really do.
Oh, they do. They do. And that's so cool that you do that. Before we started recording, we were also talking about virtual pelvic physio. And I have experienced it, and I was amazed at how effective it can be. And so I thought maybe you could share, because you've been doing virtual pelvic physio, and you will continue to do so because this is the time of COVID, and it is December 2021 when we're recording this. And
Yep.
we've got the Omicron virant.
Very whatever.
Over it.
I'm so over it.
Right?
So
But
yeah, you're
but you can still help people virtually. And can you speak a little bit about how that works and how it can actually be really helpful for people?
For sure. Yeah, we were chatting before, and I was saying that I used to work in a clinic. And then when COVID started, everything closed down. And then my son's school didn't open for ages. And I just wasn't able to go back to the clinic. And so I pivoted to being an exclusively virtual pelvic floor physio. And it's really effective. I think that firstly, it removes a lot of barriers for people to come to
Yeah.
an appointment, right? All you have to do is open up your laptop.
Yeah.
You can be in your pajamas. I don't care. You can feed your baby. I also don't care. Like,
Yeah.
it's so accessible for people. You're not commuting and all these things. And I think for many people, something that's not talked about too much is like the hesitancy with wanting to even go to see a pelvic floor physio, because they've heard somewhere that person is going to do an internal examination. That person is going to look at them down there and put a finger inside. And firstly, if that ever happens, that would be with full consent and explanation.
Yeah.
But that is the way that we would assess the pelvic floor muscles. But that doesn't have to happen all the time in an in-person appointment if that's not something that you want, or maybe it's not what you need. Virtually, obviously, you cannot do these things. So it removes that barrier for people who are like, I do have X, Y, and Z problem, but I never went in person because I didn't want to have that awkward conversation to say, no, I don't want that. So it's really, I've seen a number of people who had said I would never have gone if it was in person. So it removes those kind of barriers for people who are hesitant about that. And then, you know what, it's a really convenient way to connect with people. I do work a lot with pregnant and postpartum people as well. And when you're newly postpartum, who is going to look after your baby when you're just figuring out like the breastfeeding and the naps and the whole deal? Just bring the baby, or like just the baby can be right there in the bassinet.
Yeah.
It's actually really convenient. And I've been checking in with people really early postpartum. Some people reach out to me 3 or 4 weeks. We've worked together during the pregnancy, and they have some issues and they don't want to wait to the 6-week appointment with their midwife or doctor. And then we just go over some concerns. So I found that it's really nice. I teach people how to assess their own muscles. So I don't ask anyone to like show me their goods over Zoom. I walk people through what it would look like and feel like. And I ask them to do that as part of their homework, to learn about their own body. And if they feel comfortable, to do an internal assessment, feel what your muscles are feeling. And I teach them, obviously, what to look for. And then that helps guide the rest of our treatment, because as you can imagine, if someone had a pelvic floor, like you said yours was, which was really contracted and tight and didn't even know how to relax it, how we would address issues with that would be different from someone who had a pelvic floor that had a really hard time contracting or wasn't strong. So people who work with me, they're like active participants in this treatment. They are getting information, they're giving it to me, and we are working together as a team to address their issues. So it's really wonderful. I hope one day in the future to go back to a hybrid practice, but for right now, it's really wonderful. It's really been quite fun.
It's so cool. And I think it's, yet again, it's empowering, because you're like the person who's the postpartum person or the pregnant person is learning to understand their body and how to control it and how to evaluate what's going on so they can better manage.
Totally. And I really feel like that's my job. Like my job is I don't need my hands for my job. I don't need to make you feel better. Like you don't need me to make you feel better. You need to learn about your own
Yep.
body so that you can fix your own problems. I'm just going to teach you how to do that.
Totally.
So it's not really my jam to create some kind of codependency where like you need me. No,
Yes,
you actually
you're
don't.
going to be seeing me for the rest of your life. Yeah.
There are like other professions that are a little bit more, there's a fostering of a little
Yeah.
bit more of that. So this is just like really perfect for the way that I like to practice anyways. Like I want to empower you to just figure it out, but I will help you. But then you need to, by the time like I discharge someone or we're no longer seeing each other regularly, you have the tools and the information. And I write like long emails to every patient after every appointment. So all the information is there. Like you have the resources and then what you do with it, that's out of my control. But yeah, just like empowering people to understand and to be able to sort out their own stuff.
Yeah. It's so great. You are in Toronto, correcto?
Yeah, 'cause-
How can people find you? So you can share your Instagram handle, and if you have a website, let us know. Yeah.
Yeah. So Instagram is the place where I spend the most time in terms of social media. So you can find me at boxwellnessco. And then I also have a website. It's boxwellness.co. And on my website, you'll find like ways to book an appointment with me, or if you want to take a workshop, because I have workshops throughout the year and like they're all virtual workshops. And then I also have something, actually, I didn't even tell you about this, but I created a box like of postpartum essentials. And have
cool.
all the things that you'd need to recover your own body after you've had a baby. And so it's interesting. And so I just launched that like earlier this year, but I haven't really done a very good job promoting it. But you could find it on my website.
I completely get that. Yeah. Yeah. Life is busy.
I can't do it all.
Nope, you can't.
So it's there.
Very cool. So you, in terms of patients who can access you or people, you're in Ontario. Or what about people if they wanted to do virtually from other provinces? Are there any restrictions there?
So I can see people in Ontario for physiotherapy, but
Yeah.
I can do like a pelvic health wellness consult and we could have a conversation if someone is not in Ontario. So it wouldn't be physiotherapy. It would be, let's just chat and we can have a coaching or conversation that way. I can do that. Yeah.
Okay. Amazing. So anyone across Canada can access you. And maybe the US, question mark? If it's just coaching? Yeah.
Yeah. That's
Amazing.
We could do it. Yeah. Yeah.
Okay. Very cool. So I will post all of that information in the show notes below so people can find you.
Thank you.
Yeah, you're welcome. And thank you for chatting with me. It's been so fun.
It was a great conversation. I really appreciate you asking me. And hopefully we can connect again sometime soon.
I would love that for sure. Okay. Take good care, Aliya.
You too. Bye.
Bye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.